Presenting AC joint dislocation, arthroscopic reconstruction. The first step for any shoulder arthroscopic procedure is the diagnostic. We take a few minutes to check the integrity of other structures inside the joint, as cartilage, biceps pulley, subscapular, supraspinatus, axillary pouch to look for loose bodies. Second step will be the opening of the anterior interval rotator until we identify the coracoacromial ligament clearly. Then, we continue the subcoracoid bursectomy until identification and exposure of the coracoid process. Next step, we need to switch our vision portal and place the scope at the anterolateral portal to get a panoramic view of the subcoracoid space to go on with the bursectomy and exposure of coracoid process. It is necessary to watch very well the coracoid process. The clear identification of the coracoid edge is a critical point of the arthroscopic reconstruction of the AC joint. Now, it is time for the open procedure, which it is necessary to make an incision over the distal clavicle to reach the bone surface where the button will be placed. It is important to remark that soft tissue must treat kindly, lovely, and carefully to get a proper closure at the end of the procedure, avoiding undesirable complications related to wound closure. Small Homans retractors are located anterior and posterior to keep the exposure. Next step is the placement of the C-guide to drill clavicle and coracoid process. We use the anterolateral portal for the C-guide and anterior portal for scope vision under coracoid. After penetration of coracoid process by the K-wire, we remove the C-guide to verify the well location of the guide wire. It is important to be close to the base and at the center of the coracoid. Next step, cannulated drill bit is used to create the hole in clavicle and coracoid process. Then, passing the guide wire to lead the sutures and buttons. Then, we use a grasper or suture retriever to place the inferior button perpendicular to the coracoid process before pulling the sutures. Next, reduction is performed and final tensioning of the sutures over the superior button. Minimum 6 knots must be done to secure the suture tension and reduction. As you can watch the X-ray post-reconstruction and how it is in the follow-up. We hope you're enjoying our video about AC joint arthroscopic reconstruction. See you on the next video.